Hi, I'm Dr. Tisha Rowe. I am a family medicine physician and the founder of Rowe Docs. I do telemedicine. I've been doing it for 6 years. I'm very involved in the community, and I love partnering with the box.
Now, what is telemedicine for somebody that's in the car, they listening, they interested because they like
Yeah.
telemedicine. That sounds like it's new. What is that?
Telemedicine is anytime you communicate with the doctor electronically. That can be telephone, that can be text message, that can be video. However, most insurance companies are only going to reimburse your doctor if you do that visit via video.
Okay.
So if you call and ask your doctor to call in a medicine, they may do it for you or they may not because of the restrictions with insurance.
But now with coronavirus, are they?
So with coronavirus now, they're lifting a lot of restrictions.
Okay.
The most restrictive insurance so far has been Medicare and Medicaid. Now we can see where that's a big issue because our most vulnerable population is the elderly.
Right.
And most of them have Medicare. So Medicare has taken the steps to say, okay, for anything regarding coronavirus, we're going to cover it for telemedicine. So think about grandma, or if your mom is up there in age, they can actually use their Medicare to be able to see their doctor electronically. And actually, not just if they're doing coronavirus, because if you think about it, let's say your mom needs her diabetes medication refill. You don't want her in the waiting room with someone who is potentially sick and
Right.
coughing. So now is the time to use it for regular visits, not just if you're having
This is true. This is true.
Whenever people hear about coronavirus, a lot of people still have not done any of their own research to know what coronavirus really is. So they see COVID-19 or whatever. What is the coronavirus?
So the coronavirus that really refers to a type of virus.
Okay.
So there are other coronaviruses that we've seen over time. So when you hear them say COVID-19, so that's the specific coronavirus that we're seeing right now. Many of you may have heard of SARS before.
Yeah.
And
Right.
so that was also a type of coronavirus.
Oh, it's in the same family.
So it really is just telling you like the kind of virus that it is that we're dealing with. But for the most part, most viruses are the same.
Right.
So we're hearing coronavirus, like we go crazy, but you've heard people compare it to the flu. The flu is a viral illness that causes so in your lungs, your nose, your mouth, respiratory symptoms. So they're very similar. A lot of them cause the same type of initial symptoms. The thing that's really scary with this one is how long that it can last on surfaces. So when you're saying something lasts on a surface for 9 days, think about your phone that you have in your hand every day. How often are you cleaning your phone, right? Or kids, they've recently closed all the schools. Kids, if they go through the lunch line, if someone didn't clean that lunch area right and touched it and they had coronavirus, you're talking 9 days. That's going to be passed from person to person to person. So I agree with our mayor. Don't panic, but also be aware and be cautious of how it can travel. So what coronavirus is, it's like any other virus, but it's different in the way that it's acting in terms of how long it can last, how easily it can be passed on. And I have spoken directly with doctors in Seattle and doctors in New York. We had a big conference call earlier this week, and they're telling us, guys, we are seeing this in the hospital, and it's no joke. Like, people's hearts are going from normal, and a week later, they're dying. Healthy people. So, I don't believe in that panic fear mode, but I also feel like you said, most people don't have this information. They don't know. If you go to cdc.gov, it's not going to tell you that a healthy black male, 34 years old, died this week. You're not going to see that information. And I feel like if people understand that, then they'll say, okay, well, maybe I'm going to take advantage of this flight deal, but in July. Right? When this has calmed down. But if you're trying to hop on a flight next week because, I'll take my chances.
They're cheap, yeah.
You're really hurting a lot of people other than just yourself.
So whenever we're seeing the stories about these young, healthy NBA players that are getting infected, in our mind, we're thinking like, they fine. They healthy,
Yeah.
they rich, they got resources. It's still serious for them, too.
It's very serious for them. And I'll tell you, I'm very humbled to practice medicine because you, even outside of coronavirus, see people walk into the hospital talking to you the way we're talking. And then within a week, it's like, whoa, they'll spiral down so quickly. And the thing is, you see these statistics out there. Okay, well, only 1% of people or whatever numbers they have out there now may die. But if that 1% is your mom or your grandma or
It
your
matters.
child,
Yeah.
I don't care if it's 1%. I'm going to do everything in my power to make sure my child is not in that 1%.
How can one take care of themselves so that their immune system can be boosted so they're less likely to get the coronavirus?
So I did an interview on that specific topic earlier this week, and I say just make sure you're eating healthy. Now is not the time to be eating everything fried that you can get. Dairy is inflammatory to your system in general. So if you've ever thought about doing a cleanse or fasting, now would be a great time to do that. Hydrating, drinking a lot of water, and work out.
Yeah.
Maybe you made that New Year's resolution in January and never followed through on it. Well, be healthy enough that if something does hit you, that you can shake back and not be taken completely down by it.
Right now, Seattle has some of the highest cases of coronavirus, correct?
Correct. 'Cause Seattle, of course, outside of America, Italy, New York has a lot of cases as well as California. And there were doctors from all of those states on our call.
On your call, okay.
And I want to know, what is the CDC?
Center for Disease Control. So outside of these virus outbreaks, they're always doing research to make sure they're trying to cure different diseases. When we have what you call reportable diseases, that includes things like HIV, syphilis. Like if a doctor diagnoses you with certain diseases, we actually have to report it to the government. So they keep track of all of those numbers, like infections in the country, not just viral outbreaks.
And there isn't a cure for coronavirus, correct?
No, viruses in general don't have cures. You manage the symptoms. And some viruses, your body will clear over time. So take, for instance, if you hear someone say they have hepatitis C, but then they don't have it anymore, what they really mean is the viral load is so low, like you've been cured of it. But in general, most viruses, you can't cure a virus.
Okay, this is good information.
This Sunday, we're going to be doing services online. So for the people out here who are like, me and Jesus got an appointment. I'm going to see the Lord. Care what y'all say. He can beat the virus now. At the end of the day,
Covered by the blood of Jesus.
and that corona, it's going to be a battle for real. We're going to see. I know it will. We're going to see. Do you suggest, people to still make it to the Sunday service this Sunday?
Well, I also got a message from my church asking for my recommendation, and I suggested that we cancel church. My biggest concern with church is that, a lot of elderly people attend church.
Right.
And also because of like their health problems, they're holding on to things constantly, right? They need to hold on to the chair. Baby, let me hold your hand. You're not going to help the old lady that wants to help you. It's one thing to say,
Not this Sunday.
Say don't shake hands.
Ain't
but
no touching and
when
agreeing.
she grabs you to try to get in her seat. So I just think it's too hard to control in
Sister
that
Jenkins.
environment. So we have the technology. Virtual services would be great. Or scale down the number of services. For instance, at Wheeler, we have 4 services. Maybe offer 1 service with guidelines. Look, if you've traveled, don't come. If you're over 60, don't come. And that way, those who just absolutely insist. But what I would hate to see is like, okay, now your pastor got coronavirus.
Right.
He got a relationship with the Lord. He going to be all right.
Hey, we don't want it to be a closer relationship. He's meeting the Lord.
Right. Okay.
Does washing your hands really help?
Yes, washing your hands does help. But here's my thing, right?
Oh, Lord.
Oh, Lord. Don't
Lord.
tell us that.
No, I'm not going to say don't wash your hands. I'm going to say, like, do you think in Italy that people weren't washing their hands? Yet here we are. We know in Italy they're running out of like ventilators. So
What?
yes, wash your hands, but that can't be the be all, the end all.
Right.
And think about it, okay? Everybody wants to take a bathroom selfie because it has the best lighting. So you
Keisha.
go in.
Is that why y'all take selfies in the bathroom?
Yes, the lighting is so good.
You go in the bathroom, you snap your selfie, you wash your hands, right? Your phone was on that dirty counter.
Oh, I can't
You've
touch
already
Keisha's
washed your
phone.
hands. Now you're picking up the phone. You're back to the table at the restaurant. You put it down. Here come the person
Girl.
next to you. Yes, girl, tap the table. Now you got coronavirus
Wow.
too. So I think it's bigger than washing your hands, which is why I think despite us knowing that we're seeing it still spreading so fast because there's so much contact. Even eating out, right? You go to eat out, you wash your hands, you're eating your plate, but the person who brought you your plate, did they? I mean, I hope they did, but did they wash their hands?
Boy,
Yeah.
this
And now
is a
you touched your
never-ending
plate.
spiral. God,
So
dog.
that's what I think about.
And then yesterday, I went to the grocery store because I went to get a bunch of groceries. And one store, they had the wipes to clean off the basket. The other stores, they didn't. They were out of them. And I saw this lady. She just rolled that. She put her hands on that. I said, "Oh my gosh!" I had about 10 things in my hand because I was not touching the basket without the wipes. I
I'm
wasn't
that
playing.
person.
I had
I
like 10
cannot
things.
touch the
It was about to
basket
tip
without- I feel
over
you.
in my hand. But if those baskets aren't clean, that's how quickly someone can contract something like coronavirus.
What about pumping your gas?
Ooh, that's another one.
Ooh.
Do
Man,
a towel. Do
all
a
right,
towel.
all right, guys, girls,
We need
please.
to have some fun because I'm getting scared.
Let's wash our hands, Kiati.
All right, well, you know what? We're going to wash our hands next.